I'd like to call this Government Operations meeting to order. Roll call, please.
Commissioner Nolden.
Present.
Commissioner Winfrey.
Here.
Commissioner Ellenberg.
Here.
Commissioner Clemens.
Present.
Commissioner Young.
Here.
Commissioner Shoemaker.
Present.
Commissioner Davis.
Present.
Commissioner Newman.
Here.
Commissioner Peppin.
Here.
We do have a quorum.
Okay, I need a motion on the minutes from August 4th.
Support.
Moved and supported. Any discussion? Seeing none, all in favor? Aye. Any opposed? Motion carries. Okay, moving on down to public comments. This time is going to be set aside for public comments. Members of the public may address the board at this time. First, state your full name and city of residence, then you'll be recognized for 2 minutes. And I'll let you know when you have about 10 seconds left. At this time, do we have any public comments? Come to the board.
And Mr. Chairman, just before they begin, we did receive one email public comment. You all have a copy of it at your desk, and that will be included as part of the record.
Okay. You can come to the podium, state your name and city of residence, please.
Thank you, Chairman. My name is Ashley Prue, and I am from the city of Fenton. I just want to take a moment to thank this body for the appointment of Dr. Pamela Hackert. I am very grateful to live in a county that has appointed a professional that is willing to do what is necessary to keep our community and our children safe. That is all. Thank you.
Do we have any other public comments? You'll have 2 minutes. Please state your name and city of residence, please.
My name is Lisa Kent. I live in Mundy Township, Swartz Creek. I am not at all for the masks. If you actually read on the packaging themselves, masking our children is unnecessary and that does not work. On these packages themselves, they say they don't protect against coronavirus, the same thing you have on your face right now that the kids are being forced to wear. Are you gonna go, if you have a refrigerator to keep your food cold, you go into Home Depot and it says right on the packaging, it will not keep your food cold. Are you gonna buy it? No, the manufacturer says it doesn't work. But now you're masking up our kids. Let that be our choice. You don't know our kids. You don't know what, this one even says if you have asthma. For patients with severe asthma or severe respiratory diseases, use with caution. If they're dirty, this one's not even certified by OSHA or NIOSHA. It's the parent company, the CDC. Your parent says these masks don't work, but you all sitting here are saying you have to wear them. Why?
Thank you for your comments. Do we have anybody else for public comments?
Jennifer Isaac, Fenton Township. I'm standing here with other parents. You all do not get to dictate what happens to our children. We know them more than you do. We deal with this more than you do. You're not in my home. The government does not get a choice with my children. As far as Pamela, I love how she goes on vacation right when we're gonna have all this. Throw the Band-Aids out and then just go on vacation. The rest of us have kids going back to school. Who went to school this week? Davison? Isn't that nice? Throw out a Band-Aid and then just walk away from everything. Just understand that we have rights and all of you have spots that can be replaced from any of us. And that's gonna happen very soon. My biggest concern is that she is throwing this out. She did not get our superintendents any time to go through this. Nobody is returning their phone calls. Nobody's working with our superintendent. Our superintendent is dealing with this one-on-one for Lake Fenton Community Schools, Davison Community Schools. I am a member of the Lake Fenton Community Schools, but I will tell you, there are parents arising just because they actually go to work and work for a living. I'm not sure what Flint does at this point, because none of you do this. I'm absolutely irritated with what's happening, and you will get a wake-up call with everybody. Looking at every one of you wearing face masks that doesn't do anything to protect us. And don't think I don't have knowledge. I have family that worked through this time. Probably might have taken care of any of you. Why that time was going on, we were all working with that.
Your time is up. Thank you very much. Do we have other public comments?
I'd like to stem off that. My name is Mark Hamas from Lake Fenton Schools. I live in Fenton, Michigan. I'm a special education aide, have been for 10 years. I had a job for 20 years and I quit, and I'm working with the children for $10, $11 an hour just to work with the children. Try to make it quick. I work with the kids K through 2. The K through 6 thing, ridiculous. K through 2, we had some people get sick for a day or two. I know the number 0 is how many children died at Lake Fenton Schools. I'm here to talk about that community. I know we're throwing a blanket over a lot of the schools. I don't know what's going on at Carmen Ainsworth. I don't know what's going on at Flint Beecher. I can only tell you, show me some numbers. Give me some deaths. Besides somebody with severe asthma or a special education kid who has severe difficulties. There's no deaths in Lake Fenton. And you're gonna tell me, we'll stop the spread. Okay, you don't wanna take the spread home with grandma or grandpa. Okay, I'm gonna tell you, the K through 2, I worked with him all last year, and we have to base it off information from school to school, is that about 30 to 40% of the day, you don't have the mask on. She has a good point. I'm going in the other direction. It's called recess. It's called second recess. It's called snack. It's called lunch. And we dummy down to 9:30 to 3:30. 6 hours a day, 3 hours the mask isn't on. Thank you for listening.
Thank you very much. Do we have other public comments?
I'm going to stem off my husband. I'm Chris Hamas, and I live in Fenton, Michigan. And I have kids, a senior and a kid that graduated already from Lake Fenton. So I'm going to stem off of what my husband just said. It's ridiculous. Why are we doing this to our kids? When is enough enough? I mean, why do some of you have it on? Why do you think that it's okay to walk into a restaurant and you have to wear it, or then all of a sudden you sit down, oh, now you're okay, you're safe? Like you said, what's the data? Where is all the numbers? Nothing. There's nothing. Why are you doing this to the kids? It's ridiculous, and we are not going to put up with it. We're going to stand up for our rights as our parents, because the kids cannot do this. And we had kids at Lake Fenton at the school board, and the kids came up and they were thinking it's ridiculous. They want to have a normal life, and you guys are trying to ruin it, and they cannot get this time back. Thank you.
All right, public comments. Do we have any other public comments? Public comments twice. Oh, state your name and your city of residence, please.
Carly Lamb, Clio, Michigan, City of Clio, Genesee County. I'm a critical care nurse. I work the front lines. This is not the mask that we use to protect against COVID. Not this mask, not even the N95. Not even the N95. Show me the data. The CDC, the NIH, the WHO, they can't even keep their facts straight. They cannot even keep their facts straight. You change our guidelines every single day. I have seen vaccinated people die, and beg our doctors before they died to reevaluate the vaccine even, let alone this thing that is compromising our immunity and covering up our God-given nitric oxide in our nose that protects us from viruses that are man-made. I am asking this board to stop all of this, especially with my child as a mother. I can't. It's sick. This wasn't even my speech, but we're not even testing the Delta variant because there is no test. Show me the test. Exactly. There has not been one patient at Hurley Medical Center that has been tested. Show me the result. Show me the result. There isn't any. And then I asked the infectious disease doctor, and she couldn't produce an answer for me either. So, again, show me the data, show me the research, period. Thank you.
All right. Public comments, please. State your name and city of residence.
Good morning. My name is Brooke Kleiber. I'm a resident of Fenton. My child attends Lake Fenton schools, or I have 2 children in Lake Fenton schools. One of the things that I'm having a real hard time struggling with is trying to sit down and explain to my children why, even though everything that we've learned, because we've been in it for the last year and a half, that the age group that you guys are proposing, the mandate for the masks, are the ones who are the least affected by it at all. And when it comes down to, I mean, to get to something where you're gonna threaten your kids over less than a 0.05% chance of anything really happening to you is disturbing. But I'm gonna have to try and sit in front of my children and explain to them why you have to have your face covered up, but you don't. We live in the same house. It's completely ridiculous. It's just as ridiculous as everything else. The part about the masks, when you get into the size of a virus, they're microns. They go right through it. So that, in the beginning, doesn't make sense at all. But if everybody's talking about stats, the ones that are not being presented to us because they're back and forth and back and forth. Parents in Florida in June got angry enough to send in a bunch of masks. And so some stats that are very disturbing are what are found on our children's masks after wearing them for just 6 hours, and this is one day. Pneumonia, tuberculosis, meningitis, sepsis, particles that contribute to food poisoning, Lyme disease, diphtheria, Legionnaire's disease, all different types of bacteria that contribute to severe infections with high morbidity rates, meningitis, sepsis. I mean, it's just, but this is the thing that you guys should be talking about. Why we should have to come here and fight for our kids when you guys are, well, I guess I'm not at the health department meeting yet, I apologize. But this is child abuse. Our children are being damaged socially, psychologically, and emotionally by these masks. And to enforce it upon someone, if people who are comfortable with the mask, that is fine. They can choose. The only thing that we are asking for is our own choice for our children. Thank you.
Thank you for your comment. Public comments once, public comments twice. Public comments are now closed. Moving on down to no communications, no old business. Under new business, Sheriff's Department. We have Sheriff 1, approval of a contract extension.
Move one with a question.
Move 1 with the question. And supported. Question, Commissioner Schmidt.
Could we have someone from the sheriff's office, please, come up?
Under Sheriff's coming up now.
Good morning.
Through the chair, I just was wondering why the increase in the equipment and the tethering equipment. Why do we need more?
Well, sir, because of what occurred last year, the courts shut down, and we had to start moving people out because of the COVID. And so we've actually doubled what we were a year ago to today. And it is a revenue, it is revenue, it produces revenue opposed to taxing the budget.
Okay, my question is, have we seen it, another question is, have we seen an increase in the amount of people moving through the system as far as getting their court date and actually being released from jail or moving on through the process?
It has speeded up quite a bit, Commissioner. Of course, I'd like to see it speed up a lot faster. Unfortunately, you know, we have to go through the process, and you're dealing with a lot of different components to this.
No, there's different departments, I understand, and that's kind of where I'm trying to go, that they could use to speed up the process in fairness to the people over in the jail and in fairness to the residents of this county, so our tax dollars can be spent more wisely. That's part of my question. I understood to begin with, but thank you. This is also, this is not figured in the budget though, correct? This increase?
Like I say, according to Krista, we had met with her several weeks ago, and this does produce revenue. So it's not, I don't believe it taxes the budget.
Okay, thank you.
Okay, any other question? Seeing none, all in favor?
Aye.
Any opposed? Motion carries.
Move A2.
Move A2, approval of a request from Genesee County's Office of the Sheriff to apply for a grant in the amount of $262,613 from the 2022 Stop Violence Against Women grant. There is a match of $87,537. It's been moved and supported. Do we have any questions? Okay, let's go with Commissioner Ellenberg and then Commissioner Shoemaker.
Yes, ma'am.
Is this a new grant?
No, ma'am, that amount is in-kind match. It's what other detectives do, and that counts toward this $87,000.
Okay, so there's nothing coming out of the general fund on that?
No, ma'am.
Okay, all right.
I'm
thank
sorry,
you.
what's that?
Commissioner Shoemaker?
That's all I was going to explain beforehand, because we've seen this before.
Yeah.
Before.
And Crystal's coming up
Here
too.
comes Crystal.
Okay.
So it is the hours of the major captain and lieutenant and then investigative, but we are paying that out in cash. It's just we're using that as the match. But it is coming out of
Nothing
general
new,
fund.
correct?
Nothing new, yeah.
Yes.
Okay. So no more discussion.
Thank you, Chris.
All in favor?
Aye.
Any opposed? Motion carries.
Move A3.
Move A3, approval of, move and supported, approval of a supplemental appropriations from the Office of Highway Safety in the amount of $86,724 for the purpose of funding the Genesee County Secondary Road Patrol. It's been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Moving down to number 4, approval of a change order for the purchase order 21-02249 to Bob Baker Company for the fiscal year ending
Move it with a question.
2021.
Support.
It's been moved and supported with the question, Commissioner Shoemaker.
Through the chair, are these more costs that we are acquiring because the jail has been so full, because we haven't been able to work through the
Well,
current case?
I don't know about so full, sir. We have to wash the outfits several more times a week because we're trying to keep everybody safe. So normally we didn't wash them as much, but we're constantly making sure they're clean. And of course, if you continue to wash, they wear out, so we have to purchase some new oranges.
What are we trying to avoid when we're washing them?
What's that?
What are we
sir?
trying to avoid when we're washing them?
What are we trying to?
Avoid, the purpose of washing them?
Just to keep things clean because of COVID.
Does COVID spread on clothing?
I have no idea. I don't know if anybody knows that, sir, but we're making sure that we want to keep everybody safe at the jail, that's for sure.
Just a question there. So most of these increases are because of the COVID policy and procedures, what you're saying?
Yes, sir.
Chris, I wonder if we discussed with Crystal if there's a way to recoup these costs through any of the CARES Act money or American
I
Rescue
believe
Plan?
they would qualify. I don't know if we've approached it, sir.
Okay.
I'm not sure on that, but I do believe it'd qualify because it is related.
All right, thank you.
I believe.
Okay, any more discussion on this? Seeing none, all in favor?
Aye.
Any opposed? Motion carries.
Move A5.
Okay, it's been moved. Do I have support? All right, support. Approval of extension to the contract between Genesee County and the Genesee Health Systems in the amount of $95,904 for the fiscal year 2021 and $96,236 for fiscal year 2022 to provide one police officer through September 30th, 2022. Revenue from this contract will be deposited into that account. It's been moved and supported. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Do we have any other business? Commissioner Shoemaker.
Mr. Chair, I would like to put a motion forth that we hold a special meeting of the full board tomorrow to discuss these mask mandates.
I'll second that.
Been moved and supported that we hold a special board meeting to discuss the mask mandate. Any discussion on this? Yes, Commissioner Ellenberg.
Do we have, does it have to have how many hours does it have to be posted for the meeting?
18.
So what time do you want to have it at?
9 o'clock.
Okay, any discussion on this? Roll call, please.
Commissioner Nolden?
Pass.
Commissioner Winfrey?
No.
Commissioner Ellenberg?
Yes.
Commissioner Clemens?
No.
Commissioner Young?
No.
Commissioner Shoemaker?
Yes.
Commissioner Davis?
Yes.
Commissioner Newman?
Yes.
Commissioner Peppin?
No.
Commissioner Nolden?
No.
Motion fails.
Okay, do we have any other business before us? Yes, sir. Commissioner Shoemaker?
I'm trying to gather myself because I can't believe something this vital to a percentage of our county can't be discussed. And You know, I sit here and I don't know how many of the rest of this board actually have children in school right this second. I know most of you. You may have grandchildren, but you don't have children in school. And the fact that we can't have an open discussion about this, because what are you afraid of? If you're going to say no, you're going to say no. But the fact is I have children in school. I've seen the effects of it. I have to watch my children every day, and I watch the children that are around me every day. I think it's shameful. Shameful you can't take an extra hour and a half out of your schedule. Come down here. I know I'm generally the one asking for strange things or trying to do strange things, but these are kids. This has been turned political more than it should. I'm sorry, I said from the beginning, I thought that it was a great idea to leave it up to the discretion of the schools. And I still stick with that, because they elect people at that local level to determine what's best for their students. And the fact is, no one wants to talk that there's been other options put out there by school districts to divide these kids up so that some could go into masked areas and some could go into non-masked areas, and guess what? The health department shot that down. But you don't want to talk about that, which is shameful. So I'm sorry, I know you guys get tired of me lecturing, but I have kids. I've seen how this affects them. And the fact is, you've heard me talk about my children, and we go back there and you're gonna tick me off completely because you're gonna walk back there, you're gonna take those damn masks off your face, and I'm gonna have to look at you. And it's just a crock of crap. Because take your time today, do me a favor. Go to a kindergarten class, go to a second grade class in your district and tell me if the schools are on, or go to a preschool and tell me if those masks are staying on the faces of those children. Let me know how that works. Talk to some teachers, because I've talked to a lot of them. And the ones that are for it, bless their hearts, great, they should be allowed to do it. And that there are superintendents that are willing to put classrooms together for those kids. But that we're not willing to reach a middle ground. A middle ground is shameful. Thank you.
Mr. Chair, we are here to represent our community, and our community is here speaking to us, asking us to think about this, consider what they're saying. They're speaking some facts here. My mom's been a teacher for Flint Schools for 35 years. She was there. I went in and helped out during the beginning of COVID. And those kids towards the end, I guess, but those kids were not wearing masks properly where it was going to do them any good. First graders, kindergartners, they don't even fit on their face properly. They set them down everywhere. There's bacteria that gets on them. It's doing them more harm than good. And we don't even know the full social impact of this, of their physical well-being. It can affect, during these critical times where they're trying to learn social cues, their face is covered. And the percentage of deaths from COVID is 0.03%, I believe. That's less than the flu. And we weren't talking about that when the flu was going around every year. So I think you guys should consider what this is doing to kids. It's very near and dear to my heart because I've loved kids and teaching and helping my mom out. She's at Clio now. She taught summer school. They went 6 weeks without a mask and out without masks. The kids were a lot happier. You could tell that it made a difference on their learning abilities. They ended up there for a reason because they lost all that time because of COVID. And there was not one case of COVID without wearing masks. So I urge you guys to consider this.
Thank you for your comments. I am actually a retired school teacher, and I run an activity center in the city of Flint. We actually ran virtual learning, and we also ran a summer fine arts camp. We had 55 kids in the fine arts camp. Anybody that comes in my building has to wear a mask, regardless. So, everybody has their opinion on certain things, and they're gonna do what they're going to do, and other people are gonna do what they're going to do. So it's all about choices. So that's where we're at right now. So at this meeting is adjourned.